In today's Your Healthy Family, we're talking about the recent two-day training conference UC Health held right here in Colorado Springs to teach medical professionals across our state how to train the general public on treating trauma. Dr. Thomas Scheppel is the trauma medical director at UC Health Memorial and explains the BCON bleeding control training like this.
It teaches you essentially how to use hemostatic gauze, regular gauze, and tourniquets to assist in allowing patients to survive, even not as a medical provider. It teaches you how to hold pressure. If you can't hold pressure, what do you do next? If that doesn't work, then what do you do? And the answer is call for help.
Dr. Abid Khan is a trauma and acute care surgeon at Memorial.
We're losing too many people in the field to bleeding. And bleeding that potentially is preventable. And so what our goal here is to train people on how to train the lay public on stopping bleeding.
One of the main points of the training is teaching everyone the ABCs of bleeding. A, alert somebody, call 911. B, find the source of the bleed. And C, compress, apply pressure.
We are seeing a rise in trauma across the country and across the world. This can come from mass casualty events. Anything that can be done to prevent death from bleeding is going to help people. It's going to help the victims, it's going to help the families of the victims. And the same way that we have for years been teaching people how to do CPR in the field, this is as preventable and probably even more effective than CPR will be in preventing death.
The training also works to dispel stigmas that might prevent someone from helping a person who's injured and bleeding.
What people need to know is that the risk from assisting someone who's bleeding and contracting a bloodborne illness such as HIV or hepatitis is almost zero. You can pour HIV blood on your intact skin and you will not get HIV. Same with hepatitis. Even if you take a needle that is contaminated with hepatitis or HIV and stick yourself with it, the risk of transmission is very low. It's well less than 10%.
This training is now going to be rolled out to the public across the state. And here in southern Colorado, if you have a group that's interested, a Boy Scout troop, your workplace, pretty much any group or anyone can reach out and get more information. You can do it by emailing Memorial Hospital at injuryprevention@uchealth.org. For Your Healthy Family, I'm Ira Cronin. For more health stories, head to yourhealthyfamily.com.